A lot of people think that, oh, you're just going to grow out of ADHD once you hit adulthood, and it is true that for most people they are able to focus a little better once they become adults, and a big part of that is because the frontal lobe is developing.
Mm.
That's the last part of the brain to develop, and that has to do with attention and impulse control, task switching, that sort of thing, and really doesn't fully develop until we're 25 to 30 years old. So oftentimes the symptoms do improve, but studies actually show that probably the majority of people with ADHD in childhood actually do have at least some degree and could even meet criteria for ADHD in adulthood.
But on a basic sense, it's basically a disorder that's predominantly characterized by symptoms of inattention, impulsivity, and hyperactivity.
Well, oftentimes, at least from my experience, I haven't seen as much of the hyperactivity, but definitely in adults, generally less hyperactivity, although I have seen that aspect.
Yeah,
And
so those would
others.
include things like fidgeting, squirming, difficulty with remaining seated, excessive talking, interrupting others or blurting out answers, or difficulty waiting for one's turn. So as Dr. Bynus said, we don't see these quite as often to the extent in adults that we see them with children.